Thank you everybody for joining. May is Mental Health Awareness Month, and today we'll be speaking on the importance of mental health in not just your daily life, but in your health as well. It has a significant impact, and we have a whole group of experts that will be helping you how to first understand if you have, depression or anxiety, and that's where I think our focus is going to be today, how to manage it, but more importantly, how, the group that we'll be talking to you, how did they face the challenges and what worked for them and what didn't, and the resources. So we'll keep it interactive. We have our chat box, so please put your comments in, put your question in as well, and we'll be very happy to answer as much as we can. This will probably run a bit longer than our 60 minutes because we have so much to speak. We have a lot of people joining from out of state, our experts, and I'll be introducing them one by one. But before we get into that, I want to introduce Dr. Gaurav Jain. Dr. Gaurav Jain is a world-renowned nephrologist based out of Alabama, University of Alabama, and he worked with us on something called Kidney Care First, and this is looking at patients with end-stage kidney disease, and what anxiety and other things that brings in, and the importance of screening for mental health in these patients. So, Dr. Gaurav Jain, do you want to come on?
Hey, everybody. Dr. Rastogi, thanks very much for your introduction.
I think your camera is still off.
Oh, I thought you wanted my... It's good to see everybody.
Yes. So, Dr. Jain, can you just discuss the importance and the prevalence, maybe more, of mental health conditions in our patients with advanced kidney disease or kidney disease in general?
Absolutely, absolutely. Thanks for giving me a voice here. I think it's an opportune time to talk about mental health in all patients, like you said, and professionals. But I have a bias towards my patients with advanced kidney disease and end-stage kidney disease. As you know, we have a very high prevalence of kidney disease in the country, and many of these patients struggle with their medical conditions and the burden of disease. And often in advanced kidney disease, the worry that they will end up on dialysis, and what would dialysis bring? Are they going to get a transplant, not get a transplant? What does life with kidney disease entail? And what's interesting is that even though we have large studies that have discussed the prevalence of mental health in these patients, there is still a lot of concern that it goes underdiagnosed, and even when it is diagnosed, it goes undertreated. To answer your question about prevalence, it is based on what study you look at. The prevalence of depression in patients with advanced kidney disease could be anywhere from 30% to 60%. So almost half of these patients are depressed. About 1 in 4 is anxious. Many of them have sleep disorders, and continue to struggle with these on a day-to-day basis. And I think there has been, as part of many programs across the country, there is increasing recognition that not just the mental health and the associated burden of it, but what it does is there's actually clear proof that this leads to worse outcomes overall in these patients, including mortality, right? And sometimes you think about, what do we care about mortality? Because mortality is really that number that everybody goes by in scientific literature. But I think even on a day-to-day basis, many of these patients are living with these foggy minds, not knowing what to do. And there is concern on who treats them. The primary care physicians are worried that they don't know what medicines to use and how to adjust the dosing of medications in patients with kidney disease. The nephrologists are too busy managing their kidney disease and other complications. And there is a huge shortage of mental health experts. It seems like, even though it seems like on this panel we have world-renowned experts who are here to help us out, but when you're actually trying to get a patient seen, there is a challenge in these patients making it to the mental health experts. Um, one, because there's a shortage, and second, because these patients just don't have resources. They're already spending, about half their time in a week at the dialysis unit. So to ask them to then go and see a mental health expert once a week for behavioral interventions seems like such a huge burden.
Mhm.
Um, so I'm rambling here, but you can
Well,
tell.
you're not rambling,
Yeah.
actually. You pointed out some very, very important points, Dr. Jan, and I know we have worked together, so I know where you stand and how you approach things. But first of all, it's a lot of it is underdiagnosed, right? And then if it's underdiagnosed, obviously undertreated. But even if it's diagnosed, and we worked on that, how do we interface with our psychiatry and psychology colleagues, right? Because they are concerned about a few things. We're concerned, but there's no interfacing, fragmentation of care, and living in silos, and that's really an important thing because it does impact the care. And we talk about patient activation. That's the other measure that we did in our KCF model, right? So,
Yeah.
so, so I mean, it's not just that mental health. It is important, and we have Brandy and Jim who are joining us over here that they treat a lot of our patients. I refer them my patients because it's very important to get the best outcomes that we take that aspect of their overall health as well. And a lot of us, I mean, I'll be introducing Dr. Sharma next, but we as internal medicine people don't really get too much of that in our training and the tools and resources, right? So yes, the tools and resources are limited, but you take great care and in Birmingham, Alabama, and what the population that you serve over there too. So I think we can do something about this, right? And I know uh, Mr. Ishan Jan is going to be speaking something about that towards the end. But thank you so much, Dr. Jan, and if you can please stick around because we do need your input in a lot of other things. But I will now talk to Dr. Anil Sharma, our psychiatrist, who oversees, I don't know how many psychiatrists do you oversee, Dr. Sharma? 80, 90?
We are about more than 80 now.
My God, wow. You're a busy man.
Yes.
So I think, Dr. Sharma, from a psychiatrist standpoint, you just heard Dr. Jan, the problem that we have right now, overall, but especially in our kidney patients. And there's one more thing that I want to mention before you get into that. So we're talking more about anxiety and depression over here. So that's what we're focused in. And I can tell you, not all, but a good portion of that anxiety also comes from the unknown, right? And how do you address that? By getting more knowledgeable about the process, talking to other patients, and that's what Core Kidney does, our circle of core. So I think when we say knowledge is power, it really is. So getting more knowledgeable about your condition, how it impacts talking to other patients is very, very vital. So with that, Dr. Sharma.
Thanks for the invite, Dr. Rastogi and Dr. Jain. It was really good to hear your thoughts. And you're right, there's stigma and there's shortage. So there's disparity. There's a lot of disparities when it comes to mental health, not just for SMI, which is severe mental illness, but even for common things like anxiety and depression. It's very difficult. A lot of people don't recognize these symptoms. They think it's part of normal life, which sometimes is. As you mentioned, Dr. Rastogi, prevalence of anxiety, how much anxiety. If we look at anxiety disorders itself, there are more than 30% people suffering from anxiety in United States alone. And this huge difference between general anxiety, like normal anxiety, and anxiety disorders. So normal anxiety is important, like there are tests, we have some deadlines coming up, we get anxious, but it gets better afterwards. There's actually a bell-shaped curve between anxiety and performance. Some anxiety is important. If we don't get anxious, we don't get things done, right? So some anxiety is important, but when it gets to point of diminishing returns, that's a problem. So as I said, anxiety means like worry, fear of unknown. But when it starts get affecting your daily life, your health, your work, your relationship, that's when you need help. And what help? I mean, you use, some natural things to treat anxiety first, like exercising regularly, deep breathing, cutting down on caffeine, like, no coffee, no tea. You know, People think alcohol helps with anxiety, but it's completely opposite. In short term, like, it may help people with anxiety, but long term, it creates more anxiety and depression. Same thing goes with cannabis. Some people argue with me that cannabis helps anxiety, but in long term, it's it produces more anxiety, more panic, more paranoia. So, what's when it's time to get help? It depends on each individual. Some people have high threshold with anxiety, some have low threshold. But the moment it affects starting your life and it persists, for like 6 months or months, and the intensity is so high that you cannot work, you cannot function, and when we say anxiety, it's different type of anxiety. Some people have phobia, like a specific phobia. Some people have general anxiety, fears. Some people have panic disorders. All these are different, but it's important to recognize, talk to your family members, talk to therapists, psychologists, psychiatrists, and get appropriate help.
Mhm.
As my psychology colleagues may say, CBT or cognitive behavioral therapy works great for anxiety.
Mhm.
Not a lot of people need medication, but some do.
Yeah.
So we usually use SSRI type medication, buspirone or sertraline, Lexapro, etc.
Mhm.
When you talk about stress and anxiety, high comorbidity with depression and also with substance abuse.
Mhm.
People start abusing alcohol, they start abusing benzodiazepines to the point, like, first benzodiazepines can be prescribed by physicians, but when they don't get it, they start buying on the streets. And that's the downward spiral there. Uh, Same thing goes with depression. Like, some depression is part of life. Some of the best work and art has been done when people were in their blues or sad. But the moment it starts affecting your life, your work, your relationship, and it persists, for months, that's when you need help. And basic health could be, talking to somebody, talking to your friends, talking to your family members, talking to, if it doesn't help, then go to a counselor. There are support groups, both for anxiety and depression. And same thing goes with depression. People, when they're depressed, they turn to alcohol a lot of times, which is the worst thing to do, I mean, because not only you get addicted to it, but it makes you more depressed. So break that cycle, reach out, reach out doing simple things like mindfulness, deep breathing. There are even apps nowadays, which can help you regulate your life, make sure your sleep is good, cutting down on caffeine intake, etc. helps. If it doesn't help, then of course, you need professional help, like medications, etc. But try that things don't go to that point first.
Dr. Sharma, this is a really great and following Dr. Jan. But I just want to highlight a couple of things that you said. And we have an addiction, world-renowned addiction specialist today joining us as well. That these CBDs or alcohol, they're quick fixes at best, right? And at the end, they are, and I think that's something really important. But also depression and anxiety leads further to addiction, which makes just things worse in general. So I think that self-awareness is very important. And the other thing that, you mentioned about, some patients might need medications, and that's completely fine. But though that should be your last resort. And by medication, we mean FDA approved medications for depression, anxiety. And our amazing psychologist, Dr. Jim Cunningham. So, whenever I send a patient to him, I always get a feedback, and he will make it very clear that if he needs to get the patient to see a psychiatrist first, they will do that, and then he will start his treatment. So if there's some underlying disease. So I think these are all very important. And I can't overemphasize the importance of a caregiver because they can get depressed and anxious too. And I think that's something else we need to keep in mind. But Dr. Sharma, I know you're very busy, but if you can stick around for a bit, that'll be great. Any questions for Dr. Sharma from our audience? Um, um, I don't know if any questions coming in. And then also you mentioned a lot of resources. Is there any way you can, so these are validated resources, right? Because a lot of resources, if there's any way you can email them to us, Dr. Sharma?
Yes, we'll
Yeah.
do that.
Okay. Thank you so much.
Thank you
Really
again.
appreciate that. Okay.
Bye-bye.
So that was a wonderful start to our Dr. Jain and then Dr. Sharma giving really laying down the foundation. Now the and people who know me also know that I do tend to focus on rare kidney diseases um, a bit and genetic disorders come under rare kidney diseases and that has a very different kind of impact on the mental health because here you're not just dealing with your own condition but your family, your kids, right? So I think that just so with that I'm going to invite Nanette Zumwalt, who I think everybody knows here. She's the board member for our Circle of Core Kidney Foundation. Nanette, she has PKD herself, and she had a transplant. She is the CEO of Higher Power, so dealing with drug addiction that Dr. Sharma mentioned. So, Nanette, are you available? There you are.
I am. Thank you, Dr. Rastogi.
So, just your journey, Nanette, and how you dealt with it. I know Dr. Rick Zumwalt is here too, who's a amazing neuropsychologist. But tell us more about your journey.
Yes, so Dr. Zumwalt is an amazing neuropsychologist. He's also my husband and has been my caretaker through the course of my disease and transplant and recovery. Just to share a little of my story, staying on topic with the mental health, there's a lot of experts on this call that I think could speak to giving us a lot more advice. But just coming from a patient and personal story, I think that I really didn't recognize mental health as being part of my story until I had a recent rejection issue over Christmas and the beginning of this year. And I think that was the first time that I really allowed myself to recognize that mental health was part of my story, more so than my diagnosis, more so than my family history. I lost my mother after dialysis to heart failure with polycystic kidney disease. I went through my own transplant. And really, it is a journey. I think what's most important, and I think what is important from a patient perspective, is to know that this is an ongoing journey. And so there's going to be different scenarios that we're going to continue to deal with in our recovery. And it's really important that we stay on top of our mental health. Even when we think we've got it, a situation can arise that can really, impact us in a way where we need extra support. Leaning on caregivers, leaning on your providers, and as Dr. Sharma so eloquently said, reaching out to other resources in the community and making sure that you're addressing that as much as you're addressing the medical side of your disease.
Yeah, and Nanette, you're obviously um, an expert in the field, dealing with probably one of the toughest cases, right? And not just nationally, you do it globally. Drug addiction and the worst kinds, right? I mean, these are people who are very, very sick. But you yourself had to go through this, and it was a different. And what I do know is your husband and your family, but especially your husband, was always on your side. And
Yes.
and and I think that's really important because sometimes, not sometimes, a lot of times patients are not aware of that.
Right.
So it's their friends, it's their significant others, their family members that really, because mental health can go unnoticed,
Mm-hmm.
undiagnosed. We talk about
Mm-hmm.
kidney health getting undiagnosed and unaddressed, and that really has an impact on the outcomes, like Dr. Jain pointed out. And it's not just kidney health; it's all outcomes that can have. So once again, I think we need to keep especially with
Yes.
any chronic illness, whether it be kidney disease, diabetes, heart
Mm-hmm.
failure, whatever it is, I think you need to really keep a low threshold for suspecting that there might be something. And there are resources available depending upon, you know, where they fall in where they are at that. And just like we said, we should always meet them where they are, right? So I think that that takes there are, resources are limited. Dr. Jane, is an expert in this field in kidney disease, and they are limited, but there are resources out there and programs like this, networking support groups. We have a lot of people attending today are patients who will share their story. But thank you, Nanette.
Thank
Please
you.
do hang on with Dr. Zumwalt, because we do want to have feedback from everybody in this. So thank you, Nanette.
Thank you for including me. Thank you.
Nanette, it won't be complete without you. So
Thank you.
we and I know how busy you are and how busy Dr. Zumwalt is as well, but we really appreciate this.
Well, we're happy to be here and happy to contribute any way we can.
And I think this is what it really means. At 5 p.m. on a Friday, all of them show up, right? To help and support other people. So I think that's
Yeah.
amazing, Nanette. That's
Yeah.
amazing. Thank you. Thank you so
Thank you.
much. The next, I do want to point out one of my other favorite people is joining from India, Jaipur, Sagrika Rastogi. So, he's a clinical psychologist. I don't know what time it is in India, but thank you for joining us, Sagrika.
Thank you so much for having me. It's very early. It's 5:30 on Saturday morning, but I am enjoying the conference here. I am first of all, I would like to thank everyone here who've just shared their views. It's really nice to hear how much people focus on mental health and how much they have the insights about mental health, how much they care about being well and promoting well-being. So thank you so much, Dr. Anjay, for inviting me here.
Oh, absolutely, Sagrika. And you'll be joining us. Sagrika is an amazing clinical psychologist based out of Jaipur, India, and she's going to be working on some projects with us as well. So thank you for joining us, Sagrika, that early in the morning.
Thank you. Thank you so much.
Okay. And then next, I think I would like to invite Surabhi, one of our beans, to speak. Surabhi is our undergraduate, wonderful Bruin beans, and she is working on a lot of health policy. And this is where I think, you know, when when you're impacted by these conditions, that she really didn't have any control. So instead of being defeated by it, she is converting it into a mission in her life at such a young age. She's only 19 years old, and really working on making changes at our even at bills in legislature. So Surabhi, you want to talk a bit about your own health and the challenges and your face, and how did you deal with them at such a young age, actually?
Yeah, thank you so much for having me speak, Dr. Rastogi. This is actually like one of the first times I'm speaking about my health publicly, and it's something I've wanted to do for quite some time, so I really appreciate the opportunity. But I started struggling with chronic GI issues when I was 16 years old, and it was completely out of nowhere. I essentially just started throwing up one day every time I ate or drank food, and as one can imagine, that's very like surprising and unordinary, especially when it happens for weeks at a time. And both of my parents were immigrants, and none of us had had really any experience operating or working with the healthcare system. So I ended up having a very delayed diagnosis of about 5 to 6 months after I started having these symptoms, and they carried on. And I think that at the time, I never really understood the magnitude of how my mental health was impacted because again, I was 16 years old. I was a high school student and I was really just craving this idea of going back to having my previous normal life. And I think this is a very common theme that I've found out by talking to other people who have dealt with very like extreme health challenges as like young people. There's this crave to be normal, to not have to experience hospitalizations, disruption to life. And I think for me especially, I didn't really think I needed any mental health help at the time. I was under the stigma like, oh, like I'm fine, I'm perfectly okay, like this is just a temporary thing. But as this started expanding and really disrupting my life to like more and more extremes, following me into college, I realized that while I didn't have full clarity on what exactly was wrong on my diagnosis, these things were starting to weigh on me, and they were starting to interfere with my relationships with people, my mood, my like happiness. And I think throughout it, there's this emphasis like, oh, like you're doing so well handling this. But I realized slowly that I wasn't actually handling anything. Rather, I was just ignoring the problems. And I think that's what really led me to like start seeking mental health help, because I realized I wasn't processing, I wasn't dealing with my issues, and that was exploding in onto other people in my life. And I think realizing that really helped me, because the first time I met with a therapist was when I was 16. And at the time, I really was not interested in it at all. And I think when a patient is ready to take that step for themselves, there's a very big difference in how effective the treatment is. And I think by taking those steps when I was ready, I was really able to have a lot more success with dealing with my own emotions and problems. And again, like other people mentioned, there's also a big toll on caregivers. And I don't think my family realized that, but my parents also went through a lot. So after seeking it myself, I encouraged them to as well seek mental health help, which I believe helped them too. But yeah, I think another thing that really helped me, which I think CORE does a really great job of, is being around other people who were dealing with health issues. I never experienced that in high school, but coming into college, I was really fortunate to meet with a lot of people, a lot of young people who had dealt with very similar issues. Even if it wasn't the same diagnosis as me, a lot of our experiences were the same, and we understood each other. And I think having that connection was really, really helpful for me, because I'd been so isolated my entire time. But overall, I really wish that I had understood that mental health resources weren't just for people who have like diagnosed mental health disorders, but also for people who are just going through a really rough time in their life, whether it's physically or with other issues. And I wish I'd seek things out earlier. But thank you.
You're only 19, Survey, and you're doing amazing, amazing. Wow, that was really, it's not just your journey, but also what you thought through, right? And at such a young age, and you're changing that, those challenges that you're facing into something very productive. So that was amazing. Thank you so much, Surbi. And I didn't know this is the first time you're sharing your disease, but yeah. And by GI, I just want to make sure that people know that it's gastrointestinal, right? So like I said, any chronic illness, and you mentioned that. There's one more thing a couple of things, Surbi, that I think um, just want to re-emphasize because it's important. There are cultural and ethnic differences too, right? And that then equates to stigma, right? I mean that what is a stigma attached to it. So I think that's very important. And I always say we have to meet the patients and their family where they are. And there are a lot of culturally sensitive issues that need to be handled as well. So, and I know you mentioned, and sometimes we don't think about it, it doesn't happen, and it doesn't exist. And so yeah, and also the fact that we really have to separate these, the mental health disorders that we commonly think about from what patients with chronic illnesses and their caregivers go through, right? I think we should always think about them as well. Great. Thank you so much, Surbi. And you're going to be sticking around, so if people have questions or comments, please do ask. So thank you. Thank you, Surbi. So with that, I think I'm going to now ask our psychologist, Jim Cunningham, to join us. A lot of us know him already. He's been is a big part of CORE and has helped multiple people. And I think there's a lot of things you will discuss now, Jim, because you've had all this from all these experts in the field.
Absolutely, Dr. Stogie. Thank you for the invitation and having me on. Tangentially, one of the things that I want to mention before this is I had no 15 years ago, prior to that, I had no relationship to nephrology. I mean, I was just a general clinician. My degrees were actually in body dysmorphia, anorexia, bulimia, otherwise specified. But the fact that we have people like Brandy and Nanette and Rick on the panel, it really helps me because as a clinician, I can sometimes not go to a place where they can go in terms of the treatment modality. So I just wanted to start with that, and it can never be overlooked. Somebody who has experientially experienced, all of the pervasive issues that go on with kidney disease. So, but just a few things that I want to, a few bullet points. So, everybody talks about mental health and I guess they equate it with well-being but I think it's when you clinically talk about psychology, I want to bring it down to a little bit more of I don't want to say science, but I guess for lack of a better term, there is a certain pedagogy or a certain curriculum that prevails, and I think there is a way that you can treat CKD, PKD, hypertension, heart disease, diabetes, anxiety, all of the mood disorders we're talking about. But what I do with the core kidney patients specifically is I try to deconstruct or I think there has to be a certain amount of pathologizing. If somebody comes, and they have been told that they have stage 4 kidney disease, I think that has to be addressed. But I think then you work backwards and you give them skills, you imbue them with skills that are going to help their life. And regardless of where they're at, and I don't want this to seem like psychotherapy is like a Pollyanna kind of thing. I think we need to get into the nuts and bolts of how we treat and how we do interventions and change people's behaviors. I think it's something, I don't want to say it's rigid, but on some levels, there has to be a basic understanding that they need to proceed in a different way. And I understand most of the time, a lot of times it's genetics, but a lot of time it's predicated on behaviors. So that's one of the pieces that I think are important to work with. And also, when you're dealing with persistent depressive disorders or major depressive disorders or certain types of anxieties or certain types of reactivities or any of the myriad of things that clinically present when somebody's diagnosed with one of these variations or Alports or I think there's a way for each specific condition that you proceed. So the vocabulary changes, the verbiage changes, but I think there's a universal way that people kind of get to a point where they get better, or it imbues them with a certain degree and a certain amount of hope. And that's really primarily to put them in a better space. And it's a collaborative kind of journey. I don't think we can do it alone. I don't think psychotherapy singularly can address all of the needs. Like it was just alluded to earlier, I think the collaborative group therapy and the universality and the continuity of that with something like kidney patients or people on dialysis can actually really help improve their whole outlook. And, also, we talk about exercise and we talk about diet and but these are things that you can sit there and talk about until you're blue in the face. But until people wrap their brains around how they work and they start getting the behavioral modification and the benefit from using them, they don't do any good. Mm-hmm. So there has to be a kind of adherence or a certain kind of accountability, if you will, for people to start going down that road. And and I'm not, and psychotropic medication too is a very viable alternative a lot of ways. Some people really need some kind of changes with their, GABA or serotonin or norepinephrine or any of those kind of neurotransmitters. They need to be altered sometimes when people get into real difficult kinds of projectile circling the drains mentalities. So, yeah. That's, I don't know. Does that resonate or?
Yeah, no, it absolutely does. I mean, obviously, we talk a lot about my patients, that you see a lot, and everybody's different, right? They bring different, their background, their issues. So, um, what if there'll be top three things to say to a patient, what has worked, what they should focus on, what would they be?
Well, the first thing I try to do is establish a therapeutic alliance because a lot of times the people's first um, experience with therapy is right after the diagnosis or you're referring to them. So they have a lot of times they have a stigma attached with it, or they think, they have all these other competing interests. They may have to be seeing multiplicity of doctors or going or maybe even starting dialysis, and they're trying to, therapy is not high on the list.
Right.
And so I just want them to understand the reason we're doing it is not for an adherence to just showing up for therapy, but that it actually try to give them tools to make them their skill set or self-soothing techniques to make their lives better immediately. So yeah, you can do cog-B kind of work, behavioral cognitive kinds of I do in the immediate sessions. If I need to do collateral resources like a psychiatrist, or I need to use a certain instrument to, Beck depression. And I don't know. There's a lot of different things we can do, or tests I can administer to determine the amount of depression or the amount of reactivity or the amount of anxiety. There's certain um, instruments, testing instruments that I can that I can test them with. So, but the therapeutic alliance is the first thing. The second thing is I give them homework. And sometimes this takes a while, but I'm very emphatic about them meeting these deadlines. And, even if it's just learning how to walk a block, or if it's, I use exercise as a big kind of template or framework for how I work with people because it's something that has always resonated with me and it makes them feel better. And, and you've got to take people where they're at. I understand that. So, behavioral modifications is what I would say.
Mhm.
And sometimes, you have to look at doing collateral referrals. I think group work is wonderful, like what Nanette does.
Mhm.
And sometimes there is the necessity for people to, people come to late stage kidney disease with a morbidity of things like drinking problems and poor diets and diabetes, and a lot of times there's a lot of comorbidity, like it was just mentioned. So those things have to be addressed. So there's a big educational piece to this. Everybody, I think a lot of times when people think of psychotherapy, they don't know what it is, but I think it's important to get that working definition. And
Yeah.
there is a clinical piece, a very real clinical piece to it.
Yeah.
And there is a real kind of curriculum that I think prevails that most of the time, it's just not artsy, and it's not like just pulling good feelings out of the air. There has to be some kind of rudimentary um, conversation about, okay, this is how we proceed.
Yeah. No, this is excellent, Jim. So thank you so much, and you'll be sticking around. So if there's any questions, there is a question that came up, but I think that's more question. This is from Barb Hershey, who I know very well. And the question is, when you go to a specialist that is unaware of your condition, let's call it IgAN over here, IgA nephropathy, how can a patient convince that doctor that they do know what they're speaking about in regards to their own condition of IgAN? So, Barb, I think that's a really it's IgAN is still. I mean, it's probably not as rare as we think it is, and it's definitely not rare for our nephrology specialist. But I think it's constant reminders to the providers that bringing them information if you have a diagnosis already. But I always say the difference between an expert and a second opinion, and I think it's always sometimes to get an expert opinion, that somebody who actually deals with the rare diseases and take those notes. And I can tell you, especially a person like you, Barb, but our patients with rare diseases are normally much more informed, but sometimes they're providers that don't deal with rare diseases. So I think, but we just had to keep on working on it. But thank you so much, Barb, for pointing this out. That's an important. So next, I think Brandy, you're a kidney donor yourself, and maybe you can just share a few things that has worked. You take care of a very big clinical practice.
Yes, thank you so much for having me. Yeah, I think everybody's kind of a lot of experts on this panel have talked a lot about some of the modalities, some of the interventions that could be used. One thing I did want to talk about is when somebody's going through a chronic diagnosis, a lot of times you go into like automatic mode or just kind of like survival mode. You're talking to a lot of clinicians, you're going through like a lot of clinical stuff, and there is a high rate of dissociation between the mind and the body. So this is a lot of times when I'm working with people like this, I do notice that it is important to go back to the somatic therapy approach and really do that reconnection between the mind and the body. There's a lot of sometimes a feel of loss of control. So self-advocacy is really important in these situations.
Mhm. Yeah. And then the other topic is about kidney donation and stuff. So that's going to be a separate one. That's a topic by itself. But there's a lot of psychology behind that.
Yeah,
The pre and the post, right?
for
So
sure.
thank you, Brandy. And you deal with a lot of adolescents.
Yes, I deal primarily with children and teenagers.
Yeah, that's a whole. And well, Surbi spoke, and I think what a powerful presentation she gave. So
Amazing.
sharing her story. So
Yeah.
thank you, Brandy. Thank you so much. And you'll be sticking around as well. Now, Dr. Zumwalt, Nanette's husband, um, and an amazing neuropsychologist. So, anything you want to share, Dr. Zumwalt?
I want to say that, I mean, maybe this isn't the right forum to say it, but core kidney is it, man. The core kidney represents everything that we're talking about right now. And, there's the moving into, you become aware that there's something wrong with you. It's not right. And you're moving into the medical care and you find out that there's a kidney issue and you're finding out that it's end stage kidney and you're finding out that there are treatments and then moving through. So you're going through the medications, the ideas of surgery and transplant, and then moving out of, now how do I heal? How do I get better? And you're identifying all the factors, that support, healing and recovery. And this whole process is a transition that the families are going through, the patients are going through. Doctors see it all day long. The medical providers see it all day long. Psychologists see it all day long. We all feel like we're very familiar with what's going on, but it's very new to the families and to the patients. And so this transition phase is a very scary place because no one's been there. No one's taught us how to address this before. And this is where programs like CORE, you reach out and you have an advocate. And I can tell you my own personal experience with that, where I met with Dr. Rastogi and he said, call Brian. And, and man, I mean, my wife was fighting me, she was like, I'm fine. There's nothing wrong with me. I'm not, we'll figure it out later. I'm not going to ask. I can't ask. And it was a huge hurdle that transition moving into the treatment phase. And just having that one person reach out that says, hey, I've been there. I'm advocating for you. It's time for you to start advocating for yourself. What an impact that was. And so just understanding, I think, overall, that there is a transition taking place. We're moving through a pretty traumatic situation in life where the potential is, nobody wants to speak about, but there's, the potential is not good. I mean, but on the other side, there's great hope and there's great potential for recovery. And so just engaging in that whole process of understanding that, this is new. This is a new process and something new. I don't know what to do. So reach out to the experts, reach out to the mental health experts, reach out to the chats, the forums, do some research and then start advocating for yourself. And then family members start advocating for you because it's just a phase. Once once you get through it, life is great. And actually, life is great while you're going through it. We've had the greatest experience going through this with you, Dr. Rastogi, and with Core. It was just it's life changing experience.
Mm.
And
But
so,
Dr. Zumwalt, you're being very kind, but I've known you for a very long time. I've known the Zumwalt family for a very long time, and one thing that was very clear to me, this has been a journey that I've been a part of, right? The Zumwalt family journey, and you were and are the anchor for Nanette, and the kind of care that you provided, always looking out. I mean, that just and Nanette will say that it's so, and I think this is a classic example when the patient is so much into it that they don't realize, the and that somebody like you steps in and always at the appointments, listening to, taking notes, um, and you're an amazing neuropsychologist, Dr. Zumwalt. So I think what you have said is having a positive attitude, right? And there are a lot of stuffs out there. You just have to go and look for them. I mean, that's the key thing. There are resources out there, and I'll tell you, we used to do those kidney fairs at the beach. We probably will go back next year, but or maybe even this year. But I still remember this person who flew in all the way from Australia, and he had PKD as well, and and what he said to me at the end was that I spoke to all these doctors, but when I really spoke to a PKD patient, that's when he'll say it is going to be okay, right? And those are the ambassadors you're talking about, Dr. Zumwalt, like Brian and Mary Beth, and obviously people on this call, Brandy and Nanette and everything. So I think they are. You just have to reach out. There's also self-awareness. I think the biggest thing that I see is people don't know, or they don't want to seek out help, or there's a stigma attached to it. So I think we have to get over that, and it impacts all walks of life. It impacts and their health, their own health.
unfortunately, we've seen, the people, families, and individuals who haven't been able to grasp the mental health side of it and stay in avoidance and stay in denial.
Yep.
They're where they know there's people are telling them that they're decompensating, and yet they're just not they're not able to engage, and that's the sad side of it. But it doesn't have to be that way. It really doesn't. And I think more important than anything is talking about it. Just express. Just get it out. Whatever's in your head, get it out and get it into somebody else's ear and let somebody else communicate with you. And then, kind of lead down the path of I'm going through this transition. I'm going to make it, and it's going to be great. End of story.
Yeah. And I don't know if Dr. Zamont, you heard what Surbi had to say when she shared. That was a very powerful, what she spoke. I mean, just at that young age of 19 years old, she has been through so much, but instead of going the negative way, she's making it a positive thing. And her, her comments were very, very powerful. So thank you, Dr. Zumwalt, and thank you for all that.
Comments reach a lot of other ears,
Yep.
and
Yep.
They will benefit. They will benefit. It's like exponential benefit from it.
Yeah, but you've done so much, Dr. Zumwalt, and you've done so much for Core Kidney. And this is over time. It's not you show up in one program, it's two programs. This has been for over a decade. What you have done. So we really appreciate it, Dr. Zumwalt. Thank you so much.
Glad to be here.
Thank you.
Yes. All right.
Now we're going to bring Ishan Jan, who's in high school, and he has interest in mental health in our kidney patients. So, Ishan?
Hello.
Yeah.
So we have heard some incredible stories about how mental health and its is affects dialysis patients, its prevalence, and also how psychologists are working to combat this. And one of the things that Dr. Cunningham mentioned was this idea of constant intervention, that dialysis patients need constant reinforcement. And additionally, there are many techniques that can help depression in dialysis patients. And so one of the things I've considered is how to make AI work for these real life scenarios. So one app that one project that I'm working on is an app for mental well-being for patients with chronic kidney disease. And so what this app does is it provides specialized interventions to the dialysis patients to bridge the gap between clinical psychologist visits so that patients can receive this constant reinforcement without having an additional burden of constant psychology or constant mental health professional visits on top of their dialysis visits.
That's amazing, Sean. That's amazing. And I know you'll be working with the Bruin Beans and you'll be working with Core Kidney as well. And Sean's dad is who you heard from is Dr. Gaurav Jain. So you have big boots to fill, Ishan. Very good. Thank you. Thank you so much.
Thank you.
And then I think on one of the other resources, we have Elena, an amazing social worker in the expert panel too today. And Elena, a lot of times people don't understand the role of a social worker, but a very good social worker can have such a powerful impact on the outcomes. And for dialysis patients, technically they are all required to have a social worker. So if there's anybody on dialysis in the audience, then do know that there is a social worker that's provided. But once again, Elena, maybe you can highlight their role a bit more.
Okay, thank you for having me, Dr. Rastogi. It's an honor. There's been a lot of conversations today about, specific interventions and what therapy entails. And there's also a different aspect of whether you're talking about being on dialysis or going through the transplant process or just having end-stage renal disease. There's a lot of guilt that may be involved, especially if you need additional support from caregivers, from family. There are people who have survivor's guilt after getting a transplant. There are people who just generally feel like they are a burden to their family. And so that leads to people being quite shut down in terms of those interventions, in terms of getting support, in terms of asking for support. And so some of what a social worker does could be kind of a liaison between getting you that therapy and just being around and providing you that support system, and also being a liaison with your doctor. So social workers are part of a medical team when they're in the hospital, and they really can help bridge that gap of information. They can offer resources. A lot of the time, people don't know what insurances cover and what resources they have available to them in terms of paying for medical services, in terms of paying for medications. So social workers can help with, reaching out to insurances and providing resources for that, as well as providing resources to therapists, to groups, providing group therapy, and also just being an additional person who is there, whether it's in the medical office or in a dialysis center or somewhere else, and just being that additional person of support. And sometimes knowing that and knowing that that person kind of has a relationship with the doctors and with the family, it makes it easier for patients to open up and reach out to somebody. And also, if you mentioned the dialysis center, those social workers see patients on a pretty consistent basis. So they really get to know the patients, and they get comfortable with the patients, and the patients get comfortable with them. And oftentimes it can start with just saying hello and just, not even really having a conversation about mental health per se. But that allows for that build of trust and that conversation to kind of start, and that allows people to open up and really get the support that they may need. So it could be really a vital role in the care that we provide to patients.
Yeah, and I think, Elena, you're an amazing social worker, but I think, most of the people don't know the role of the social worker. And I would say it's the unsung heroes, right? They're, as you said, they're a big part of the team. And a lot of the stuff that we're speaking about today, a lot of it goes through the social worker, if you have one, right? Now, dialysis patients are required by CMS to have, a social worker, but a lot of them don't. And if you have a social worker or are assigned a social worker, a lot of practices have social workers, right? Medical social workers. I also want to point out Christina's son, Galo, is also going to social work on the East Coast. So he's going to go in that field too. And I think that's a very important field that's not recognized enough by both by patients and by providers. So thank you. Thank you so much.
Of course.
Yeah. Thank you, Elena. Thanks so much.
Thank
All
you.
right. Now our next guest is our very my dear friend from all the way from Texas, Tiffany Jones Smith. And Tiffany is going to introduce herself because I don't even know where to start. But I do want to point out that Tiffany is going to be leading our next chat. That is June 1st. And she'll tell you why she'll be doing that and the importance of that. So, Tiffany, thank you so much for joining us.
Thank you for having me, Dr. Rastogi. And thank you for all of the great work that you do and the leaders that you've brought here. I am the chair of the Chronic Kidney Disease Task Force in the great state of Texas. I'm the first woman, the first African American, and as you can see in this current climate, it's a big deal to be leading an organization or a task force of this nature and to be appointed by the governor. And I also head the Texas Kidney Foundation. And what we do is early detection of rare and chronic kidney diseases. But I think the most important thing that I am is a patient who's lost 16 family members to a rare kidney disease called AMKD. And that's what brought me to Dr. Rastogi. And staying on to the topic of mental illness and mental health, I would say mental strength, what really fueled me throughout this journey has been empowerment, helping people empower. And so we created a program called Hope because of the sort of lack of hope that we saw initially. But once we found so much information on rare kidney disease and such a community and the need for community amongst the rare kidney disease patients, then we began to create places for them to have that. And those were kidney health clubs. That was the HOPE program. So we help people learn what their options are, just the transparency that can be provided to patients with all of the technological breakthroughs we've had in the last 10 years and the therapeutic breakthroughs. That is what helped me walk down this journey because the pivotal moment for me was, and Andre, you're the only person who's ever asked me to tell what my mental journey was on this because no one ever asked me that. I'm here to help people change policy, and I do that on a state level, on a national level. I do that. I deliver on policy change. But the pivotal moment for me was when we found out that I had AMKD, because my disease is young. It was discovered in 2010 by your colleague, Martin Pollack, over at Harvard. The pivotal moment was telling my mother. When I told my mother, because the disease had woke up in my brother, and so he was losing his kidneys. And when I told my mother, my mom said, "We did this. You mean your dad and I did this?" And I said, "No." And so from there, we sat down with everybody on our team. We peeled back all the programs to the studs. We sat down with genetic specialists and we talked through what it would look like to tell people how not to suck the hope out of the room. And that's how we brought genetic testing to communities by a community-led organization for the first time in the United States, in Texas, in October of 2024. But it was an 18-month process prior to that with Natera and their people, and they were excellent, excellent. They listened to every question, everything that seemed silly that I wanted to ask, because it was parents and caregivers and sisters and brothers that you have to deliver this information to in communities that are largely overlooked, that have cultural folkways and mores that many don't even bother to understand. So that's what fueled me. That's what still fuels me. Your program fueled us as well. I mean, you had a great doctor there. I think his name is Jeffrey Vale. He made the statement, all kidneys are pink. We really put a lot of emphasis on that to say to all of our minority communities, you're not alone, you're not different, you're not a mistake, a mess up, a screw up. What you are is a human being. And when your doctors are looking at your kidneys for a kidney transplant, when they're looking at you, it is biomarkers that they're trying to fix. It's not because you're Black and you're bad, or you're Hispanic and you're bad. It's none of this stuff, and I just say thank you to all of you for the work that you do for people like me and the patients that we support. And I'm so looking forward to having you on June 26th speak to the great state of Texas. And I tell you this, we have been so far behind on mental health in Texas. But Dr. Rastogi, when everything in the world, now I'm a Christian, so I will say when God tells the Pharisees to sit down, they have to sit down. People have to hear the science, because science is what will save us and what is saving us. And it is you in the scientific community that we as patients have to stand up for. And I will stand up for you every day. Battle down Texas, because we're the hardest ones to fight. California's going to be a breeze. We'll have a great time with y'all.
Yeah.
But I'm with you for life, my friend.
Thank you. Thank you, Tiffany. I mean, like I said, you once again we heard from Surabhi, and you'll be working with her as well. How she converted all the challenges in a positive direction, and that's what you have done. And I see the passion, the move. We met, at a chance meeting, right? It was in Chicago.
Exactly.
Yeah, KDO
Even
meeting.
though I had read about you, I'm not going to lie. Like, I'd read about I don't know who's reading about the kidney world and the innovations in the world of kidney health, because he is kidney health. You hear people talk about disease all the time, but really, we need to Rastogi this. We need to reframe it and make it a conversation on kidney health. He's kidney health. He is hope, in a jacket. He's just walking through and providing hope.
And you are the one providing hope, Tiffany. And I'm really looking forward to our trip because, we need leaders like you. We need the voice. We need people who actually are impactful, right? And you are all of that and more. And what Tiffany was saying is that we're going to do this in Texas. I'm going to be in Austin. We have people, legislatures, and we have also senators who actually have
Yes.
chronic illnesses. I'm not sure if they have kidney disease, but they will be able to relate to what we are speaking.
So we have Dr. Boris Miles,
Okay.
who's appointed to the task force, and he has received a kidney transplant. He knows exactly what we're talking about. Both of his parents had a connection to kidney disease as well. So he's very proactive in Texas for change and and for legislative movement for the kidney community. The task force itself is charged with. There are two types of task force. There's one that just writes a paper and makes some recommendations, but nothing is done with that. And then there's the secondary kind, which is what we are, a task force that is charged with writing a paper, which we do, to make recommendations as to what can be done to alleviate the cost burden of kidney disease in Texas and the help the patients, the families, the Texans who are suffering from kidney disease. And then we get to influence and coordinate the education of practitioners regarding kidney health. And that is where having Dr. Rastogi come in and speak for uh, kidney disease influencing global outcomes. I mean, that's huge. And then representing core kidney, because that program, your program should be duplicated and scaled. I consistently talk about the duplication and scaling of programs because to actually eradicate kidney diseases, one would have to manage kidney disease in each community. We have over 200 counties in the great state of Texas. That's that means that people have to have something that they can do
Mhm.
in their community and that they can learn how to do
Yep.
in their communities. And this program is one of the programs that, to me, should be done and scaled in communities like throughout Texas, throughout California, throughout the rest of the United States,
Mhm.
because that will have the impact that one is looking for uh, on kidney disease and kidney patients in rare and chronic kidney disease, because most people don't know anything about either. And the statistics are coming out now saying that 1 in 5 kidney patients have a rare kidney disease.
Yeah.
So it's not quite so rare.
Yeah.
Like the diseases themselves are rare, but the rare community and the impact of rare disease is significant
Yeah.
in the kidney space. So I'm excited to have you come and just, as the nation's expert on this, talk about it. And I had to jump through some hoops to get them to let non-Tex. And I was like, y'all do know that everybody in Texas is not. We're not the only people with some experts on diseases. You are going to let me have whoever I want to have here. They know I will raise heaven on all of them if they don't succumb to whatever I'm asking. So most people don't try to fight me.
No, I wouldn't. That's a lot. Losing battle, Tiffany. And I really hope, so our next one is going to be about advocacy. Surbi, will be talking to you as well. There's a question coming about, support groups for adults. There's support groups for, and we'll be talking about that as well. But I think, and I'll end up with this, and I know Dr. Sonu Bhargava is here too. who's our kidney recipient and dentist. But I think what you mentioned about these counties and what you're saying is a grassroots campaign, right? We all, what they say, the rising tide raises all the boats, and we have to become that tide, right? And it has to be, and what I do want to end with today, I mean, this was such a powerful presentation. Sonu, do you want to say a few things before I get? But Tiffany, just hold on for a second because we want to wrap it up. Next June 1st is your show, so we'll talk about patient advocacy, patient support. So I don't know if Sonu's here, but so, anyways, I think what I always say, and just going back to the rare kidney diseases, it's not rare if you have it, and you have already said it's 1 in 5 have a genetic cause of kidney disease. So, who has the biggest stake in it? The patient and their family and their loved ones. So we need to speak up, right? So
Yeah, hi, Doctor. Hello, everyone. I am Sonu. I am a kidney transplant recipient, a cancer survivor, and I was a dentist in my previous life. I'm also an author, and I do believe in what Ms. Tiffany just said about communities getting together and fighting at a community level. And in fact, me and my son, for last actually, this is a 6th year, we have been curating art for awareness as a kidney health awareness program. It's not even a program. It's just we use art to make it palatable for our community. And this year we were able to get some of the local leaders and the senators and all of them got involved. And I think it's gaining momentum. And I do see a lot more people talking about kidney health. And we are making a small difference in our own capacity. Yeah, and I think staying on the topic, mental health is very, very important. And I mean, I have been a chronic, I mean, I have the long journey from acute to chronic to dialysis to transplant and then some transplant complications and then later on cancer. So I do appreciate the ups and downs and of your mental journey. And all that has culminated in me finding a voice for the patients, for, like how to articulate a patient's journey, what they go through. So I'll just say 5 words regarding that. The stage 1, I feel, is recognition, then the adaptation, confrontation, rebuilding, acceptance, and growth. And all these stages that I went through, I've spoken to a few patients myself and few other people from other chronic diseases, and I see that they all go through similar paths. The duration of each stage may be different. People can jump from one stage to another in a different sequence, but they all go through the same thing. And there are ways to overcome that. What personally I used in my life was chanting, meditation, writing a book, learning to create fusion dishes, gardening. So every time I go through something really, really, really hard, I just pick up a new hobby, and that brings me out every time. So I mean that's all I want to just end it with.
No,
Thank
this is
you.
very powerful, Sonu. Thank you so much. And we'll also talk about, and Soham, your son, has spoken about as a child growing with a parent having a chronic illness and what impact does that have on them, right? So,
Yes.
and Soham will speak about that in one of our future. So, thank you so much, Sonu. This was great. The next event is June 1st. Please do join us, and that's going to be, Tiffany is going to be leading that. This is also going to be in line with her June 26th event that she's putting together, which is very important. We want to do something similar in California under her leadership. So that's one of my major interests, that we can do what she's doing over there, bringing it to our own state and helping our patients. So with that, I think we have learned a lot. Thank you so much for attending. And I know it's not easy on after 5 p.m. This is recorded, so our wonderful beings will actually be posting that. And so with that, we'll see you at our next chat. Thank you very much.